for being here again for our 4th meeting. So I appreciate that everybody keeps coming and contributing, and I want to make sure you know how important your contributions are. We're going to be talking about that a little bit this evening. And related, I just want to put up one more time what our goals are as a group, about how in service of these goals, the Oregon School District is always guided by their 5 values. And then throughout the pandemic, it's been our 5 values in partnership with other guiding principles. And you can see those on the screen because we have had to stay true to the values and the principles in order to make decisions that are the safest for our students and for even our community. And then the purpose of the group, as you can see here, is to provide an opportunity to share professional suggestions and give input on how we can best get our students back in school safely and keep them in school safely. And I'd say that much of what has been contributed in the group has really led us to a very good place. And once again, I'll talk about that in just a moment. So I just want to go over the meeting agenda really quickly. First, I'll just remind everybody what we discussed on December 21st, because if you're like me, the last couple of weeks are a bit of a whirlwind, and so it's probably good to get a little bit of a refresher. Share some updates with you. Quick review of the working agreements per usual. Then we'll do a small group discussion for question number 1 and a large group discussion for question number 2, and then share out the plan for the January 18th meeting. So when we met on December 22nd, we had 4 questions that were posed to the group, and we separated our group into 2 smaller discussion groups. And I think with some really excellent feedback regarding the night, we learned that 4 questions is probably just too darn much because people didn't have enough time to really interact regarding the answers they were giving to the questions, and that may have been better for participants overall if we had discussed fewer topics. So we're working on that in the design of meetings moving forward. But with those 4 questions, multiple themes emerged. And just to refresh your memory, the first question was, given your area of expertise, what are the benefits and detriments of phasing in grades 3 to 6 on January 19th? Is it prudent to begin at this time or not? Because that would be 15 days post winter break. The next question number 2 is, when is it appropriate, given the public health recommendations, when is it appropriate to close a classroom or a school after we have opened and to move temporarily to virtual instruction? And then we asked a little bit about how much time should be between phase-ins, because public health recommends a phased approach. Well, how much time between phases? So we had some good discussion on that. And then finally, we spoke about how emergency order number 11 from public health does not allow competitions for medium and high risk sports. However, it does allow practices with static groups of 10, masks, 6 feet, etc. And our OSD winter sports, our winter athletes are starting practices tonight. Tonight is the first night for practices for winter sports. And other than the public health order, what considerations or research should the OSD take into account when making decisions about whether or not it's safe to schedule competitions? And we're going to revisit that a little bit tonight because that information continues to evolve. Another consideration that was put out there by the group in the context of these questions was the importance of monitoring local data. And so I want to say thank you again to Evan Fitzgerald for putting the OSD COVID-specific data together for us to examine. And I put it in the resources document in case you don't have the link. I had sent it out earlier, but it's probably easiest to put it in that one particular document. And there was a big spike on December 31st, and I sent Evan an email about it today. And he received information later on that sadly for the people in Oak Hill, the spike was concentrated pretty much there once again. So it's the second considerable spike at Oak Hill. And then another suggestion that I want to just quickly revisit from our last meeting came from Dr. Tempty. The last time he was with us, or the last time we were together, he mentioned the importance of keeping an eye out on the newer strains that are appearing, strains of the virus. And considering the fact that the UK went into a national lockdown today in order to curb the spread of their latest strain, I asked Dr. Tempty to just give us a really brief update as a way to keep it all on our radar, because we know that as we move forward, there's a lot of things that we have to continue to monitor. So would you mind sharing a little bit, Dr. Tempty?
Yeah, that would be fine. Thank you so much, Leslie. Just wanted to touch base very, very quickly on the emergence of a new lineage, or a mutated strain, shall we say. First things to keep in mind is the coronavirus is built on a backbone of genetic material called RNA, or ribonucleic acid. And viruses that are RNA as opposed to DNA tend to be much more prone to mutation. And we're all familiar with influenza viruses that mutate year after year. Well, it turns out that in late summer and early August, they started seeing this new mutant strain in England. If you ever see it in the press, you might see it referred to as B117. And that just refers to some of the mutations there. And the reason this is of at least some interest and probably out of concern is that England did a relatively good job of shutting down, of slowing everything down. But this, about 4 months ago, seemed to start coming out. And it took enough concern where people have really been looking at this carefully. And I shared with Leslie today a report that just actually has come out from London dealing with this. And the concern is this particular virus has more transmissibility than what we're dealing with right now. And where it pertains, I think, to the school age population, and it has a much larger share of those individuals under the age of 20 years compared to the existing strain. So this tends to show about a 25% increase in those younger individuals and a decrease in the oldest individuals. The other concern is that it's transmitting at a level of somewhere between 1.4 and 1.8 times the rate of the original strain. And this is being realized even in England, where there is a great deal of social distancing going on right now. So I won't say anything more about that other than the fact that this is part and parcel of what we expect from coronaviruses. As someone who's worked with these before, it doesn't surprise me. And when you have several different strains competing, the ones that tend to be more transmissible tend to rise rapidly to the top. And when I sent this information to Leslie earlier today, and she was asking whether or not this is of any concern, I said, well, given that it is in 3 of our states, Colorado, California, and Florida, and given that this is seeded in these states prior to the Christmas holiday, and 85 million people travel during the holiday, and it's more transmissible in young people, that's of concern. And I just heard now that it's been detected in New York State as well. So 4 states. Consider this virtually everywhere. The other thing to keep in mind is the only way we know about where this is, you have to take a sample of this virus and you have to basically dissect it. You have to dissect the entire genome, something called whole genome sequencing that we do fairly frequently over at the State Lab of Hygiene to find out where the mutations are and what strain this is. And so In Wisconsin, less than 1% of the viruses that we detect are ever sequenced. And so unless you really put forth a lot of effort in looking for this, you don't find it. But suffice to say, the public health system has amped up their interest and is looking for this more and more. And the more we look, the more we find it's here. And I hate to say this, but I think it's everywhere.
So I have a quick question for you, Dr. Temte. It's my understanding, I was trying to do some of my research today around this specific issue as well. It's my understanding at the moment there's no evidence that it causes more severe illnesses or there's an increased risk of death, and they're looking carefully to see that if the vaccine also puts this at bay. Is that right?
Those are really good points. Number one, we don't think this is any more likely for an individual to cause any more damage. Unfortunately, if it's much more transmissible, that means that many more people come down with this, and at the end of the day, you have more hospitalizations, more illnesses, and more deaths. It appears as though the vaccine should work for this. The downside is with something more transmissible, you need a higher percentage of the population immunized to bring this under control. So we were talking about having an estimate of herd immunity before at about 65 to 70%. And with this new strain, that pushes that well over 80, 85% of people that will need to be immunized or be naturally immune. And the rollout is not going along very well right now across the country. We're way, way behind where we should be. And so that's the more of the concern. But this one does not look as though it has any increased effect on individuals. I'll, in the same breath, say that England has now, or the UK has shut its borders down to South Africa, where there's another strain that is more likely to cause illness and death than the existing. So this is what we're going to see with a virus all over the world that's prone to mutating.
Well, I appreciate you sharing the information with us because, as you said a couple of weeks ago, this is something we need to keep our eye on, and that thankfully the positive cases in Dane County are decreasing, and we hope it remains that way. But if we see an increase, it may very well be due to a new strain being here. Is that correct?
That is certainly a possibility. And again, it just depends on the vigilance and how much we're testing and doing the heavy duty lab work that Eric Reisdorf can shed more light on, because he's on top of what goes on in the state lab. Thank you.
All right. I just think, as I said previously, that's something that we all need to be continually monitoring, and I'm very grateful that we have all of you to be able to help us stay on top of what is happening. So now, examples of how the medical working group has definitely impacted our progress. Just a few examples. I could fill several slides with this, but you did offer the input of allowing 2 weeks post-winter break to assess for safety prior to bringing more students back for in-person learning. And so we have a 15-day wait period before our next group. You spoke quite a bit about examining protocols to ensure that nothing could evolve into clusters. You know, looking at what we were doing and trying to make sure we weren't clustering too many students together as part of our process or protocol. And that's an ongoing thing, but that is something that we are even more aware of after your input. And then another example is the examination of transition supports for students entering new schools. That was discussed quite a bit last week, and I think if you were able to listen to the videos sent by our student services staff, you'll see that a lot of time and thought has been put into that too. And another one that I didn't list, but I just want to make sure I touch upon it, is that it was brought up how important it is to continue to bring other voices to the table. voices that may not be heard in this process in the way they need to be. And so we had a meeting with our families whose primary language is Spanish and allowed them a question and answer session. Because you can only imagine all the emails that, as if you're a parent in the district, all the emails you're getting and the decisions you're being asked to make. And imagine trying to do that in a language that isn't your primary one. So it was really important to have that opportunity to talk. So I thank you for all of your input. I just want you to know it's making a difference. As far as our reopening plan, you can see that we aren't bringing in any more students until January 19th. And then we have a 2.5 week delay where we then bring back additional students, and Oregon Online continues. So now I'm going to transition to Drew Howick. He's going to do a little bit of an introduction before we start talking about the questions for today.
Great. Thank you, Leslie. Welcome all. And so between each session, Leslie, Tim, Katie, and I meet to debrief the session and plan the next one. And I can tell you that the agendas are very fluid. As Leslie said in an email to me, Drew, things move quickly here. It's not by choice necessarily, but it's just things do happen quickly. And so we've had to adjust some of the agenda topics based on timeliness of things. And that's one of the reasons why the second question will be in front of us today, which has to do with athletic events and competing outside of Dade County and risk mitigation. So as Leslie said, there's two questions for us tonight. One is on mental health and one is on athletics. Leslie's going to frame up each of those questions here shortly. The first question on mental health will occur in small groups, breakout groups, and we're going to have 3 of them this time. So there'll be a chance for more discussion. And the second question on athletics will be as a full group, and I'll facilitate that session as well. So with that, Leslie will take a couple of minutes just to frame up the 2 questions. I'll come back, talk about the process, and then we'll dig in with our discussions.
Thank you. So topic 1 is mental health supports, and we are divided into 3 groups, and there will be a person who specializes in mental health from the medical working group in each group, in addition to people from the Oregon School District who are specialists in mental health, so that they can answer any questions you may have after taking a look at the materials we sent you late last week. So we're very eager to find out what input all of you may have related to supports for students who are experiencing in-person learning. And for the majority of them, it's the first time in 9 months. So we know that there are additional mental health supports that need to be put into place. And you heard about some of them, and we're eager for your input. When we come back, we'll talk a little bit more about winter athletic competitions outside of Dane County. I have some information that I'll share with you that will help illuminate that discussion in just a bit. But I think for now, Drew, I'll pass it to you to talk about our protocols for small groups.
Okay. So before Leslie brings us into the small groups, just a couple of things. What will be the same from last time? Well, one will be our commitment to the 7 norms of collaboration. And again, everyone seems to be integrating those well, and we all appreciate that. The second is, like last time, each breakout group will have a facilitator. There will be a recorder and a reporter and a timekeeper. And all of those roles except the timekeeper has been assigned, and we'll quickly do that when you're in the group. The discussion has been structured so that everyone has the opportunity to share their suggestions and perspectives. We're going to ask that the mental health professional lead us off in response to the question. The Oregon School District representative would then talk and react to that, and then we'll do a round robin so everyone has a chance to discuss, and then we'll open it up for whatever time remains to respond to what they're hearing, learning, other suggestions, comments, etc. Reporters, you have 1 to 2 minutes to give the rest of us a summary of that. As before, all that information will be that's being recorded will be transcribed and you'll have data from all the groups for those discussions. What's different from last time, one discussion question, not 4. Everyone will be invited to share their responses, and then we'll all be invited to open it up for discussion. So that's our plan. So it's 6:20. We will now go into our breakout groups. We will reconvene as a full group at 6:40. So facilitators, beware of your time. Thank you. All right, I think the gang's all here, as they say. So we're looking for a high-level summary from the 3 groups. Tim, I'm going to start with you and your group, 1 to 2 minutes, kind of key points that were made. Then we'll go to Troy, and then Andrew is a reporter, it sounds like. Great. Tim?
Yeah, very good. So we had some great feedback from our schools. Just a reminder to assess, and it's a constant assessing. It's not at the beginning, the middle, or the end. It's a constant assessing, trying to make sure that we understand what's going on in school and what's going on outside of school, and that it can be different every day. So, making sure that we're flexible. And checking in, assessing is so important. From our professionals in the audience, we heard from professionals who see only kids, for instance, and they've never seen such extraordinary need in some cases, but it was also clear that some kids, frankly, are doing really well. They, school itself is a stressor for some kids. And so there are some kids who are learning virtually and frankly doing really well with the situation currently. We heard about screeners, the importance of a consistent universal screener would be so helpful across the grades. We have checkpoints at I believe it's 3rd grade, 8th grade, and then into the high school, having access to some kind of a screener that we could use across the grades would be super helpful. One concern that there is that we are catching what someone referred to as tier 2 and tier 3 issues, and that there's a little bit of concern that, frankly, the quiet kids who seem to be doing just fine may have some underlying issues, and without a universal screener, they may be slipping through some cracks. So having access to some kind of universal screener, not only for staff, but quite possibly for families, for parents who have their kids and who will continue to have their kids learning from home. We talked about specifically learning from home and how important it is that there's an equal focus on those kids who are either homeschooled or will continue on the Oregon Online as other kids are starting in-person education in second semester. We talked about making sure that linguistically and culturally that the supports that are available are appropriate. Again, we don't think there's an issue there, but it's just a gentle reminder. There was also a gentle reminder that the need for grief counseling could be an issue, and we want to make sure that that is part of the suite of supports that are available. Let's see, and there's also a quick reminder, an important reminder, that COVID is one of those major stressors, but we are at a point in time in the year, at a bare minimum, and at the extent of this COVID situation, that housing, hunger, and jobs are other stressors that are swirling about as we approach getting back to school. And so I think that's about it. The screener issue again came up, and the thankfulness that we have around our teachers and around both the informal and formal assessments that they're doing today and will continue to do in a little bit different way as kids come back, can't be underscored enough.
Okay, great. Thank you, Jim, and your group. Troy, you were listening to another group. What would you like to say about that?
Yes. So I'll summarize group number 2. Our mental health professional was Dr. Katie Schmidt, and she led it off. Did a great summary and reported out of what she's seeing. Katie is a professional at an inpatient mental health facility here in Dane County. So I think her perspective is that we don't know what we don't know, and she's seeing the serious cases of mental illness in our youth every day. And the main takeaway is that the cases have increased an extremely high amount, and Katie reported out numbers of suicides in Dane County has doubled by mid-September of 2020 versus the same period 1 year prior. So the numbers have skyrocketed, and regarding we have great counselors and great supports in our schools, but by the time children get to Katie's facility, they haven't engaged. So what Katie sees is that the connections in schools are too passive, and that the children just aren't engaging. Some other areas that were reported out is that there's other long-lasting health impacts from COVID beyond just the mental health, and that's and one example was overeating. So students are sitting in front of the screens all day and eating more than they would if they were out of the house. There's alcohol overuse in adults, which of course has impacts on our children as well. And then another mental health impact is the impact that our students have as they see students in other schools that are going back, and they have the fear of missing out, and they're seeing their friends in other communities that are in person, and that has an impact on them. So moving on to recommendations. So there were 3 recommendations that Katie put forth. Number 1, and most importantly, is kids just need to be back in school in some fashion. and around that face-to-face support, even if it's wearing masks, something is better than nothing. And then the second recommendation was to connect in person. So can we do some more in-person support groups beyond, if it's not in the educational environment, can we just have some support groups that would be in person, as we're starting to do with athletic practices, that we can have 10 students in a room together. Can we do more of that in person? And then the third recommendation was to support our staff. So as our staff transitions back to in-person education, we really need to support them so that they can in turn support our students. That was
Okay. Yeah.
the main takeaways.
Great. Thank you, Troy. Good. Andy?
Yeah, I might be able to save a little bit of time, since Troy's group hit a lot of the same points that our group did. Information about suicides and trying to get kids into schools more in person than they are now, as well as trying to get some small groups going with that as well, similar to the connections that are run right now at the middle school, RCI, and high school. And it doesn't have to be the student services team. We actually heard about some of our student leaders taking advantage of, or taking initiative with that, as well as perhaps our teachers. And then not forgetting, as was the case for the other group, not forgetting our teachers and trying to support them as well with compassionate resilience and those types of things that we're kind of doing already. And then not forgetting the groups of students that we've already identified, and really putting some resources with them, that we know that there's some students out there that are being impacted more than some of our other students, and making sure that we focus our attention on them and try to get them to caught up or equal to the other students that are out there. And maybe if they need extra time, to provide that. And then encouraging our kids to think of others, and engage our kids to think about recovery and the new normal and what that will look like in the future.
Great. Thank you very much. Wow. Big topic. So many impacts. Leslie, anything you'd like to say to the group before we transition and talk about athletics?
No, I don't think so, other than I'm really grateful for all the note takers, because there is a lot of good stuff that needs to be discussed further. So thank you.
Right. Thank you. Yeah, so much. Okay, second topic. Leslie, do you want to make a couple comments, and then we'll get people to chime in?
I will. So you can see part one of the question was basically another go around of discussing what you'd like us to consider prior to making a final decision regarding athletic teams engaging in competitions outside of Dane County. And then if the decision is made to play outside of Dane County, what risk mitigation strategies do you suggest? And I just want to give you a little bit of context for the question as to why am I asking it twice. Well, this is a map of Dane County and the school districts that are within Dane County. And you can see, based on the yes, the no's, and the not committeds, of who's already made the decision to play athletic competitions outside of Dane County. And you can see the vast majority of Dane County has made that decision. And the ones that have not are a part of the Big 8 conference. And Stoughton, I believe, is they have a board meeting tonight. We have a board meeting tomorrow night. So in taking a look at this, you can see why it's important that we talk about this sooner rather than later, because all of the groups that you see here in green are trying to schedule competitions with schools that are outside of the county. And then this is a graphic that comes from the CDC, and it's a continuum of risk related to youth sports. And I just want to go through it very, very quickly with you. And the first is, when we were in emergency order number 10, we were at the lowest risk, skill building drills at home. So we were holding virtual practices. Right now, emergency order 11 allows us to practice as a cohort, a small group of 10. Right now, our medium and high risk sports, you can only do within team competition if you can stay further away than 6 feet which with the sports that we play, that's impossible. So other than swimming. So you know that is something that is not really within the realm of possibility. Now, superintendents from the area, several of them, including myself, sent a letter to public health stating that it's probably safer if we're allowed to have some competitions within Dane County, just with Dane County schools. Otherwise, we are going outside of the county with very different risk mitigation strategies in place. Or I don't know if I'd say very different. I would say they're different from what would be done in Dane County. And that is the choice that many districts are making right now, is at the higher risk end of the spectrum. And that's why it's important for me to get ideas from the group regarding risk mitigation if the decision is made to play outside of the county. So that's a little bit of context as to why I'm asking that question of all of the professionals here this evening.
Yeah, and why this topic is made tonight's meeting.
Yes.
So
may I ask a quick question? Am I the only one who couldn't see any of the graphics?
I could see the graphics. Did anybody else not see the graphics?
Nope, I could see it.
okay. All right.
Are you able to see the faces, Dr. Bisgrove?
I have a blank screen, and maybe because I'm on an iPad because I'm still at work, but would appreciate it if the graphics were emailed.
Of course I will.
Thank
I'll
you.
send the whole slide deck to you.
Okay. All right. So we have about 15, 16 minutes, and I'm hoping, I want to give everybody a chance to respond. You see the questions to one or both of the questions, and we'll have to move this pretty quickly. Lauren, Candace, and Katie, if you'd be willing to record as best as you can what you're hearing, and then we'll sync up all your respective comments and have one document on that. So who'd like to lead us off in addressing one or both questions? And again, I'm just going to ask for a very quick, we're probably going to average, minute-ish each. And then if there's time, we'll open up for discussion. Who'd like to begin?
I
Okay,
will.
go.
I'm going to stand with John Tempty, and I said our biggest thing we're going to have to do is keep an eye on the variant and where it is and how quickly cases are rising. Getting a sense that there are a lot of districts going outside the county, that definitely makes mitigation more challenging. I have a feeling we're going to have a lot of people, there's going to be a lot of pressure to go outside the county, but the data is what we have to follow. The new variant is showing it can transmit more easily in kids, which means that it will more easily spread through the community. So in the end, we've got to watch the data. And if we're seeing if we choose to go outside the county and we start seeing rapid rise in cases and the new variants show up, we've got to shut it down. But the bottom line is we follow the data.
Okay, thank you. I'm going to start moving and calling up people. Eric, would you be willing to go next?
Sure. Yeah, again, I would, I think that monitoring what the rates of transmission are in the community as far as how active or how intense the transmission is very important when you're looking at mitigating. And also, I feel that, without knowing outside of the county what sort of mitigation measures they have in place, you don't really know, are the kids having to wear masks? Are they having to distance? Those type of things. I think, it's hard to make a recommendation without knowing, what these mitigation strategies are in the other districts where you're considering playing. So I think at least in Dane County, what the mitigation strategies are. That the schools are following the public health recommendations. So, from my perspective, I think if you're going to choose to have sports, I think that you would be better off in a situation where you knew what the mitigation strategies were.
Okay, thank you. Shelley, and then we'll go to Beatrice.
I would say I would say we need to prioritize getting kids back to school and keeping kids and teachers and staff safe and healthy first. This is a numbers game, and absolutely agree with watching the data, but I think we also have to know and understand that while we have these great dashboards of data, we also don't have all of the data, and the people that do have all of the data are public health professionals at Dane County Public Health, and we should be listening to them.
Okay, thank you, Michelle. Beatrice, and then we'll go to Brian.
Yeah, same thing. I agree. I think we need to follow the data.
All right, thank you. Brian, then we'll go to Becky.
Yeah, so I saw a number of things that I had issue with in the Oregon COVID Winter Athletics COVID plan for athletics. And first off, self-reporting for injuries has been well documented for athletes prior to practice and play that does not hold water. It doesn't work. So I appreciate that the form was put together, but I have a bad feeling that we're going to see similar results for COVID-related reporting prior to practice and play. I've got questions about if the limitations on the number of athletes and also the limitations on the back-to-back practices and play with the facility will infringe on Title IX. I had there were a couple of, as I was reading through it, I was looking at a number of items that were kind of policy related. And I wonder how enforceable those are. And then if it were to happen, what the recourse would be. It's not clear in the plan. Also, an issue I saw with athletic trainers, and this is just my not having knowledge of the Oregon School District, is if you employ your own athletic trainers or if you rent, I want to say that, athletic trainers from University of Wisconsin, because they might have policies that do not align with this. And I'll leave it there. And oh yeah, data. Please follow the data. Thank you.
Great, Brian. Thank you. Becky, let's go to you, and then Matthew.
I'm having a little bit of issues with my microphones. I can't hear half of you, so bear with me because I've been reading closed captioning for most of your responses. I do agree that we probably need to keep tabs on public health numbers, obviously. And as far as our counterparts on the, outside of the county lines, Dane County obviously has been a little bit more stricter, but we have to keep in mind that Dane County is also a county that also has not been following rules either. So I think when it comes to practicing or competitions outside of Dane County, I don't think that it's as scary as maybe we kind of think it would be. So I would think that it'd be okay to go ahead and do that. But then again, I would probably keep tabs on public health numbers as well.
Mm-hmm. Thank you, Becky. Matthew, and then Alice.
Yeah, I think echoing what some people have already said, following public health's recommendations. And if they're saying in-county team competitions is too risky, I'm finding it hard to see how you can mitigate the risk on a riskier activity if we're saying that lower risk one is too risky.
Mm-hmm. Okay.
That's all.
Okay, thank you, Matt. Alice, and then Jill.
Thanks. Yeah, echoing just listening to public health's recommendations. It seems like as a country we're in some of the mess we're in because we didn't do that. And so as a district, it just seems like the responsible thing. If Dane County is saying those high-risk sports shouldn't be played in competition and we live in Dane County, then that's what we should follow. As much as on a personal and family level, I would love to see sports resume. Also, I think the fact that other districts are doing it, this is just from a child development standpoint, that is not a good reason to do things, just especially things that have been deemed dangerous just because other people are doing them. And so I would just go with what public health says.
Okay, thank you, Alice. Jill, and then to Aaron.
I will defer to other people who have more expertise.
Okay, thank you, Jill. Aaron, and then to John. I don't have a full screen. Is Aaron here?
Sorry, I just have a small thing to add. I agree. We should follow the data as we have been across the board here. But also, we just kind of talked about how we can support mental health. Games, sports, competition is one of those things that supports mental health. We've also already kind of talked about how kids have been sitting in front of the screen and gaining weight, right? So there are some secondary ways that we can support competition. Whether or not we go outside of Dane County, I think the data is going to have to lead us there.
Okay. Thank you, Aaron. John, and then Bill.
A lot of agreement with what's already been said. I just have a couple peripherals. Number one, it's how students get to competition. It's what parents and other family members are doing at competition. And it's what students are doing after the competition. Because these represent probably at least equally high risk situations of gatherings.
I think just for clarification, if I could make just a clarification, those are the kind of risk mitigation strategies we're looking for. Is, you know, what should parents be doing? What should fans be doing? How is transportation being accomplished? Those are some of the risk mitigation strategies we're looking for.
Great. Thank you for sharing that, Tim. Thank you, John. Bill, and then we'll go to Raven.
I don't think Dr. Hefner's here tonight, so we can go right to him.
Okay, thank you. Raven.
So I would echo what most are saying about following Dane County Public Health guidelines. However, if we would decide to play, I would suggest that we have clear rules and communication with the other schools. So if other students that we are playing the competitions with would test positive, that they are directly contacting us so we can follow up with our students. And then if we can decrease the frequency of those competitions, I know like Evansville School District, specifically wrestling, they do it once every 7 days. So there's that time period in between in case symptoms would occur. There's a little bit of a buffer there.
Mm-hmm. Great. Thank you, Beth. Beth.
Hi, yeah, so I agree as well with what's been said before. And as regards to mitigation risks, I think that we would have to continue to do what we're doing now. By socially distancing as much as possible, wearing masks, good hand hygiene, having it at sports, having people not carpool, but go, drive if you're from the same household. It's not convenient for families, but if there's a way where we can put a few of these into effect and have kids compete for their mental health, I think that would be good. And then also just to be really flexible. So if we see the numbers going up, to be okay with pulling back a little bit, even if it's just a week or two.
Okay, great. Thank you. Evan, what would you like to offer in response to these two questions?
So I'll say first off, I'm happy to expand the data dashboard to include, whatever school districts we want. So I can look at all the ones kind of in the surrounding areas now that we have better than just county data, which is probably not fine point enough to be useful for anything. And then I will say, I know, in the past, if you're on a team, busing back from a game is always something that I believe is required by the school district, unless you have some extraordinary circumstance. I would do away with that rule so that you would encourage people to go home with their parents and only their parents. You don't need 4 people from the same team all jumping in the same car. But I think you're at a point now where you will see people are willing to do almost anything if they can be allowed to play. So putting burdens on them, like having to provide transportation where possible, will be, I think, pretty well. They'll be happy to accommodate that if that means they get to play. So the last thing, obviously not from a professional standpoint, but I do think that in general, if you give all the athletes a reason to try and have good adherence to all the rules outside of school, in terms of hanging out with people on the weekends and all those things, giving them games as an incentive and other extracurriculars too. But to say, that now we're giving you something really clear why you don't want to screw up and take any extra risk. So that's it.
Okay, great. Thank you. Amy and then Katie.
Yeah, I don't have too much to add. I would hope that we could find a balance between that physical activity and our mental health and wellness for our students. And some people have brought up the transportation. I know those were laid out in those rules, and I would just hope that we could be equitable in that. If we are at some point providing or competing, that we can make sure all families have access to transportation.
Great, thanks, Amy. Katie, speaking of mental
Great.
health.
Yeah, thanks. So yeah, I am really a big advocate for kids returning to competition. And if that means outside of Dane County, I think that if we can do it safely, which I think we can, I'm really supportive of that. I think kids have been playing around the state and around the country from our own area all year. And so I guess I would ask the data gatherers here if there is any data on the kids playing around outside of Dane County and other states. I know many Oregon athletes have already been doing that. So I am wondering about the data on COVID transmission. And I love the risk mitigation strategies that Dr. Temte mentioned. I know that multiple tournaments I'm at, a lot of people are only allowed 2 spectators and they all wear masks and we travel separate, and the kids wear masks when they're on the bench and they wash their hands, and they may even sit 6 feet apart on the bench. I think there are many ways to keep kids safe. A lot of kids are wearing masks while they play if that's something that their team feels passionate about. Most facilities outside of Dane County are not requiring that, but I think that's optional. The other thing that I know some schools are doing as a risk mitigation is they're doing rapid antigen testing once a week or before games, so that the kids who are testing negative can then compete and kids who are testing positive don't compete. So I think that we could possibly explore that as a resource as well. So I think the big things I would want to know is the data. What is the data on all the kids who've been playing around the state and country? Does it show that it's unsafe? And then putting in some of those risk mitigation strategies that Dr. Temte suggested, and also looking into more antigen testing as we move forward so that we can get these kids active.
Great, thank you, Katie.
Yep.
Did I overlook any member of the medical group who would like to comment?
I just like to follow up really quickly and just to note that from working in public health, doing disease investigations, all of that kind of work, that when I say we don't have all the data, they're the ones that have all of the data. They have the stories, they've been studying all of these pieces. And so for me, that's why I say we should listen to them. They're the one. No data dashboard that we can get or we could create is as good as the data that they have in their hands right now. And we also know, at least at the state level, those data are being suppressed. They're being sued, so they can't get that information out to us. And I think we need to be aware of that. So that's why I would defer to what, people in public health are also pro mental health, pro physical activity, pro all of these other things, and they're making these decisions, really tough decisions, because they have all of this data in their hands.
Okay, great.
One other real quick comment just on rapid antigen testing, because a study just came out that was done at UW-Madison and Oshkosh by CDC. And the rapid tests are only about 40% sensitive for asymptomatics. So basically, you're giving a false sense of security by using the tests. The conclusion is if you're using a rapid test for somebody asymptomatic and it's negative, you're obligated to do a PCR test.
And I wonder about then I've heard that too. And I do wonder then about like doing a weekly PCR or something on the kids who are, competing again, just as an option. You would know much more about that than me, but.
And that's about $100 per pop.
Yeah, I mean, I just to follow up on what John had said, with the testing, it's difficult. People, I think, feel like they can test their way out of this essentially, and that's really not the case. It really has to be comprehensive mitigation strategies, but you can't just rely on a test and think you have a green light to be able to do these things. So that's my 2 cents. Thanks.
Yep.
I also just wanted to jump in for a moment and second what Amy said about making sure whatever we decide about going out of district is looked at through an equity lens. And, saying things like, well, everyone should just drive their own kids. That is not possible for everyone to do. Or saying things like, everyone's doing it anyway. Everyone is not doing it anyway. People that can afford to do it are doing it. And so just always viewing this decision through that lens too, like I know that Dr. Bergstrom is. Thanks.
Okay. Thanks, Alice. Okay.
Drew, I wonder if our athletic director, Mike Carr, he's on the call. Mike, is there anything that you want to add to this or any question that you want to pose before we conclude?
I just wanted to follow up on maybe a couple of things that were brought up. Raven had brought up the 7-day thing with wrestling, and that would be something that we would do because that's a state WIAA rule. So that would be something that we would be looking at doing as well. We do partner with UW Health. We do contract services with UW Health Athletic Training. And we've been in contact with them quite frequently on some of the things that were in that document. Those are kind of the questions that kind of came up that I just wanted to make sure people were clear on.
Okay. Thank you, Michael. Leslie, we're at 7:14, and I know you want to talk a little bit about some of the next steps in our next meeting.
I do, and you're going to have to let me get through my green arrows here real quickly before I can get to my other slide. Okay, there we go. So our next meeting is January 18th, and the key question for that meeting, unless something comes up beforehand, and believe me, something could, because as I said, things, it's like being on a rapidly shifting ground all the time. So unless something else comes up, though, our key question will be, what efforts might we take to encourage our citizens, our OST community members, to work together to keep our students in school? Because I know that was something that was discussed quite a bit at either our first or second meeting, the importance of the responsibility we all have to be able to keep the kids in school, and how can we work together to help people see it as a collective responsibility. And so I'll send out a link to a Google document where people can share their thoughts on this question over the course of the next week, so that we have some good things to talk about when we gather again on January 18th. And I think that's it, Mr. Howick.
Okay, great. Thank you, Leslie. Thank you, everyone. 7:16. Thanks for the extra minute. Appreciate it. Stay safe, and we'll talk in 2 weeks' time.
Thanks, everyone.
Thank you.
Good night.
Good night.